Hello, and welcome to the Sarcoma Foundation of America's panel discussion of the sarcoma journey from the patient and caregiver perspective. My name is Christy Arishton, and I'm the Program Manager for Engagement and Research at SFA. Thank you for joining us this evening for what promises to be a very interesting discussion. Before we begin, I will briefly go over the format and logistics of this webinar. I will be your host and moderator for this session. We have three panelists joining me tonight who will each share their journeys with the sarcoma diagnosis, treatments, and clinical trial experiences, their challenges associated with the diagnosis of a rare cancer, and resources that they relied on along their journeys. After hearing from each of our panelists, we'll have a questions and answers session. I will ask the panelists any questions that have been submitted at any time during today's session. You can participate by submitting your questions in the Q&A field at the bottom of your screen. As always, we will not be able to answer questions related to your specific medical situation. The information contained in this webinar is intended to be for educational and informational purposes only. It is not a substitute for medical advice from your physician about your specific situation. Today's session is being recorded, and a link will be posted to SFA's website. Finally, as a reminder, all participants are muted, and questions raised during the session should be entered in the Q&A field to be posed by the moderator. At this time, an important part of our mission of the Sarcoma Foundation of America is to provide educational opportunities to help empower the sarcoma community, and I am pleased to introduce our panelist. Natasha Nathan is a survivor living with embryonal rhabdomyosarcoma. She received her diagnosis just shy of her 30th birthday, and after completing treatment last December, has no evidence of progressive disease. We are also lucky enough to welcome Tasha as the newest member of our SFA staff. Natalie Stoyer took on the role of momcologist when her 3-year-old son, Sage, was diagnosed with fusion-positive rhabdomyosarcoma in 2002. Sage has very recently completed treatment, and Natalie, Sage, and their family are stepping into a new reality of life with no evidence of disease. Dan Mulligan has recently passed 5 years of living with metastatic pelvic dedifferentiated liposarcoma. Having worked formerly in the surgical field, Dan approaches the reality of his disease with a solid dose of intellectual curiosity, a great deal of wisdom, and a truly disarming sense of humor. I would like to thank each of you for joining us today, and I will now hand it off to Tasha to get us started. Thanks, Tasha.
Thank you so much, Christy. It's great to be here. So like Christy said, I'm Tasha. I was diagnosed with embryonal rhabdomyosarcoma about 2 weeks before my 30th birthday. However, that journey started about 2 months before my 30th birthday, and what felt like a really long time to me actually later became known as a quick time in sarcoma world to get to my diagnosis, which was a shock to me at first because that felt like a lifetime. So I experienced my first symptom end of January 2022, and it was a sore throat. That was it. I had no other symptoms at first. It was simply a sore throat that I thought was COVID. I had not had COVID at that point, so I was testing every day for a week. Actually had a wake to go do that weekend, so I was like really trying to make it there, and just had a sore throat that wouldn't go away. But I had no fever, no anything else, and it was just irritating. Think by that Monday, after a week of negative COVID tests, I reached out to my PCP, tried to go in, but because it was during COVID, I was only able to be seen over virtual until I persisted and kept demanding essentially that I come in and be seen. Tested for strep, also negative, did a round of antibiotics just in case, and of course, nothing fixed it because at that time we didn't know it was a sarcoma. It began to swell. So my throat began to swell, and I should mention my tumor was located by my right tonsil. So I do think that part of why I was able to receive a diagnosis quickly in the span of 2 months was because that tumor eventually grew into the size of an egg, and it's very hard to ignore an egg in your mouth, especially if it's blocking your airway, which I was eventually put in the ICU for airway risk. But I don't know if I really can call it a misdiagnosis, but I was seen in the ER once it really started swelling and antibiotics didn't work, for what they thought was a peritonsillar abscess, or a fancy word for an infection, which they attempted to drain. And, you're not really supposed to cut into or drain a tumor, but we didn't know it was a tumor at that time. So they tried to aspirate it and drain this abscess, and that did not work, of course, and it bled, eventually leading to a large hematoma in my mouth that they needed to evacuate and cauterize in a surgery. So that first surgery, we essentially debulked what we didn't know was a tumor, and it immediately grew back. I was told to recover within 3 weeks, like a tonsillectomy. In the span of that 3 weeks, I went into the clinic every 2 days, just demanding to be seen, and was saying, nothing is happening. What do we do? I was told over and over to just monitor it. It's fine. It will go away. We don't really know what this is. I live in Boston. I assumed, the medical community here they are extremely competent, but for a rare diagnosis, that you don't see every day, it's hard to diagnose that. So I was told to monitor, we'll scan it in a few months if nothing happens. But yeah, very strange. We've never seen this before, et cetera, et cetera. So within 3 weeks, is probably almost March at this point, it had fully grown back, but looked very strange because it had been cut into, and ended up in the ICU. This was probably after my 5th opinion. I had 4 opinions initially that wanted to monitor, and I started to feel very uncomfortable with that plan. Saw a 5th opinion who was actually a family friend and a ear, nose, and throat doctor. And he ended up hospitalizing me, thinking that it was very serious. And thank God he did, because it was. So I ended up at Mass General Hospital, Mass Eye and Ears, and, known for their ear, nose, and throat specialties. That was where I was put in the ICU after a day in the ER. They did another surgery to debulk and considered it an exploratory surgery. I ended up with a surgeon who had 10 years of experience in head and neck cancer. And he pretty much, we've later discussed this, that he pretty much knew almost immediately that it was cancer, and just not what kind. And so he took about 90% of the tonsil. It was all necrotic tissue or dead tissue in that surgery, sent it for biopsy. The issue with that area is it's a very high bleed risk area of the body. And so, not knowing what he was working with, he wasn't exactly trying to get clean margins, but he was also being very cautious of the bleed risk for that area. So took what he could, sent that for biopsy. It took about a little over a week to come back. I ended up back in the hospital the night before I was scheduled to get my biopsy as outpatient, because I ended up having a post-tonsillectomy massive bleed. So that's a risk with any tonsillectomy. The assumption is the tumor was growing and kind of pushing on that area, which caused a huge bleed. So I ended up back in the hospital for observation, and that's where I received my diagnosis. And so my surgeon came into my hospital room and said, he walked in, and you just know, you're like, this isn't going to be a good conversation, but let's hear it. And he said, this is, I think, pretty serious. I'm 99% sure you have a malignant tumor. And I have parents who have worked in oncology. And so my only knowledge of malignant was, that's not a good word. And it was like, okay, say more. And he said, I'm pretty sure it's a malignant tumor, and also a pretty rare one. And I thought, that tracks with my personality. Keep talking. And he said, it's a rhabdomyosarcoma. I'm waiting on a couple more things to finalize that. And my next question was, how the heck do you spell that, and what is that? And so he went into the specifics. Came back 30 minutes later and was like, yep, 99% is actually 100%. We're just now waiting to find out what subtype it is. And, this is day 1 of my introduction to being a cancer patient. So I was like, subtypes, what do you mean? Like all of these questions. So that was March 22nd of 2022. It was, a huge airway risk. I was having a lot of difficulty eating. I'm a small person generally, but I was about 10 pounds down at that point. So it was causing a lot of other issues. They transferred me to the oncology floor, and within 48 hours, I was in chemo. So it's a very quick turnaround time from getting my diagnosis into treatment. And in that time frame, you see a lot of different specialists, one of those being, for me, fertility. I was about to turn 30. They had a lot of questions about what my, hopes and dreams were for family planning, where I was at in life, what we wanted to do about that. My options were pretty limited going into treatment 48 hours after being diagnosed. But we started my chemo right when they got confirmation of what subtype I was for rhabdomyosarcoma, which is the embryonal, and went right into chemo from there at like 11 p.m. inpatient. So we started like as soon as we possibly could. My treatment was based off of what we typically, I suppose, treat children with rhabdomyosarcoma with. What was puzzling to my doctors was that I was a 30-year-old being diagnosed with rhabdo, because it's generally seen in children. So I'm super curious to hear from Natalie, because I know she has a lot of experience with that. But my surgeons and doctors, I've been seen by the tumor board and had multiple hospitals collaborating in the Boston area on my case. And, it was, what can we take from we know about children, but also, we don't see this often in your age group. So how are we going to adjust treatment for you? I ended up having 14 rounds of chemotherapy, 5 different types, and then 7 weeks of radiation. And that was done simultaneously with chemo. So there wasn't a pause for chemo and then radiation. It was all throughout. So I started chemo end of March, ended it end of December of 2022, and did radiation mid-April through end of May. So I know that for me, we did discuss surgery, but because of how high of a bleed risk my location was, we didn't want to do that. They described the surgery as morbid, which is a terrifying word to hear when they're talking about surgery, though it just means, it could be a pretty gruesome surgery. So not necessarily mortality risk, but just a very gruesome surgery, which they wanted to avoid just for quality of life at my age, and bleed risk. So our goal was to, in my oncologist words, blast this tumor into the stratosphere with radiation and chemo, and then go from there. We did not see a lot of shrinkage until pretty much the end of chemotherapy. I know I have a specific mutation, KRAS mutation, and I don't know the science all behind this. Christy can talk a lot more about that. They do think that might have complicated its reaction, and possibly the fact that it was, cut into before we knew what it was. But it shrunk a little with radiation. You could see a difference there because it had grown into my mouth from the incision point. We could see the tumor, and pieces of it were breaking off throughout treatment. So we knew it was responding, but the part behind my soft palate wasn't showing a lot of response to treatment for most of it, probably until about round 10. So the last 4 rounds were pretty critical of chemo, and I ended treatment with evidence of disease. So I ended treatment with a tumor. Their plan from that point, and we discussed this around round 10, was to monitor, wait and see what the approach would be when I finished. And if it grew, we would talk about more chemo. We would talk about potential clinical trials, or a potential surgery, which was what they really wanted to reserve for last resort, or the next line of treatment. But I'm lucky in that it has continued to shrink since finishing treatment. We're on a 6-week scan protocol. So pretty much from December through August, I was doing 6 weeks, every 6 weeks getting scanned to monitor it. Then 8 weeks. And now, because it's still shrink, we're doing every 3 months. So it's, kind of a balance of the radiation you're getting from scans and monitoring the disease. So at this point, I'm called no evidence of progressive disease because it's still shrinking. But, I think the biggest challenge is, aside from how challenging treatment was, I think for me, aside from feeling pretty crappy, I was on a feeding tube for 6 months throughout my treatment. It was pretty much the second week of radiation. I got slammed with every side effect you could possibly be warned of. All the thrush, all the mucositis. I was already really low weight to begin with because of the location of the tumor. That was pretty impossible to avoid a feeding tube. So I was on that. I absolutely hated it, but it saved my life. So I've come to terms with that. I was able to get off of it in October. So I had a few months left of chemo at that point, but then ended up with C. diff twice, which is a bacterial infection in the colon. So I had a lot of complications that when you hear about cancer in the media, this is not the side of it that you hear about. And those often caused more issues for me than the actual treatment or the actual cancer. I always think back to the sore throat, and I was like, that was barely a complaint compared to everything else I experienced during treatment. So the tumor itself didn't cause me that much pain. It was more so the treatment side effects and everything else. On top of that, I think it's a pretty isolating diagnosis to have, being in a rare category. A lot of my questions to my team were met with, I don't know, and we'll find out, but we're not sure. And I wanted reassurance from them. They are amazing. I love my team like my own family. But I remember the switch in my mindset from going in with questions of expecting hard answers to going in with questions and expecting to collaborate with my team on options. And I think that's something that I feel really strongly about is in my learning experience from my diagnosis is just your team has the expertise of the medical field and you have the expertise of your body, and you need both of those expertises to come to some sort of path forward. And you're a team, you work together. My oncologist said to me the very first day, you're the captain of the ship, I'm your co-captain, we work together. And I thought that was the best thing he possibly could have said to me, because that set the tone for all of treatment. And it was really a collaborative experience with the entire team. In terms of resources, they were my biggest resource. I absolutely adore them. They connected me to a lot of resources within the hospital, be it patient financial services, help on all of the things that you don't realize you need help with outside of the actual treatment. But yeah, I think really treating them like my Google. I stopped Googling. I was a notorious Googler before, major hypochondriac, and took those questions right to my team. And they know that if I don't feel like I understand or have an answer, I will keep asking questions, and they're very patient with me. But it's necessary to take care of your health. So I'd say that was a big resource. Also super isolating is being a 30-year-old with cancer. I've watched all my friends, enter relationships, get married, have kids, get promotions in the time that I was going through chemo, sitting at home, having to leave work and go on long-term disability. My mindset is, every day I'm here is still a great day, but it is really hard to watch that and come to terms with the fact that you had plans for your life and, they'll maybe happen again. And it was always my mindset that I'm going to make this happen again. But it is still a tough reality to come to terms with. And so social media was a really big resource. I did not meet any other sarcoma patients until I started sharing my story on social media. And that made it a lot less isolating. There's good and bad with that, but it ended up being a resource that, at this point, I have a lot of close friends in the sarcoma community that I couldn't have gotten through treatment without. And survivorship, entering this new reality is a whole nother challenge. So that was definitely a big resource. But I think, things I wish I had that I didn't find a lot of that until the end of treatment. And so I sometimes wish there was just this giant network of like, oh, you had an experience like mine. Can we connect and talk? And, some place where that existed without having to find that on your own. But yeah, I'm happy to answer any other questions. That's kind of the 20-minute version.
Thanks, Tasha. We'll do all of our questions at the end, and we'll go ahead and pass it over to Natalie to share her story.
Hi, everybody. I'm Natalie. I am honored to be here. I can't agree with Tasha more with a lot of the things she said. So, kind of to piggyback off of her story, my son Sage was diagnosed with fusion positive rhabdomyosarcoma, which is alveolar, is also another name for it. It's the other subtype than what Tasha had. When he was 3, he was diagnosed. He had a large lump in his calf when he went to bed, and I went in to check it out, and it was a very hard nothing I've ever felt before. And I called the on-call doctor, is he eating? Yes. Does he have a fever? No. Everything checked off. So we started the next day. That was a Thursday. So of course, Friday we went in and we did blood work and everything that we could do to figure out what was going on. That weekend passed, and then Monday.
Looks like we might have lost Natalie there. Dan, why don't you go ahead and take over for a while, and then if we get Natalie back, she can pick up where she left off.
Okay. So, hi, my name is Dan Mulligan. I'm a 58-year-old person with metastatic dedifferentiated liposarcoma. Liposarcoma itself has 4 different flavors, right? So we've got 100, and then liposarcoma and leiomyosarcoma make up like a big chunk of that. And then dedifferentiated liposarcoma, along with pleomorphic liposarcoma, are the ones in the LPS group that can kill you if they metastasize and recur a lot. So that's kind of the basics. My story was so much easier than Tasha's. Like, I'm listening to her going, man, I had kind of an easy path. I back in March of 2018, and like Christy said, I've lived in the surgical world for 37 years. So I used to travel a lot. I was a chief commercial officer at the time, and I had been traveling around and noticing that I had this lump in my pelvis that kept getting bigger and bigger. And the only thing that happens to men in their pelvis after the age of like 30 is indirect hernias. So I thought I had this indirect hernia, and I knew I'd have to get to it at some point when I got home. But I was at a startup and I was on the road for 3 weeks straight. Oh, there we go. All right. Pause. Back.
Did you want me to keep going?
Heck yeah.
Okay. I'm sorry about that. I had a little bit of an interruption there. So just to head back to Sage's story, we went through with our PCP. It felt like forever, but I think it ended up being 3 days. We got some lab work back. That all was fine. And then we pushed for some scans. So he went in for an MRI. And when we got the MyChart results, it immediately said, like, in their suspicion of rhabdomyosarcoma, Ewing sarcoma, needs to be sent to the Children's Hospital in Iowa City to oncology. And I truthfully didn't even know what that word meant. I didn't know what oncology meant. I've just never had to deal with anything medically to that point. So when I texted my sister-in-law, who was a nurse, she immediately was like, "Oh my God, Natalie, that's cancer. Like, I'm so sorry." So we got in the car and we went. It's about a 2-hour drive. We went that night, and it was a 2-week inpatient stay. They did all their own scans. They did a biopsy of his leg. Sage's cancer did spread to up. So it was, his original tumor was in his right calf. It spread up his right leg to his lymph nodes behind his knee, to his nodes in his pelvic area, his inguinal nodes up there. And then he also had a distant met to his right elbow bone. And that's something about rhabdomyosarcoma. It can be in the bone as well as tissue. So it was a little bit eye-opening. I didn't expect him to have all the extra stuff there. I thought it would have just been in his leg. So it was very, it was a lot. So once we found out what kind of cancer he had, just like Tasha, he was starting chemo within 48 hours. At that point, we did not get a second opinion. We felt very comfortable where we were, and we felt comfortable with his oncologist and that they were truly going to take care of him, and they knew what they were doing, because I didn't, and either did my husband. And, you know, we felt that we were where we were supposed to be. We didn't really have any treatment suggested to us at that time. We were just asked a couple like general questions about treatment. You know, fertility is going to probably be an issue down the road. You know, just kind of all the side effects of what the chemotherapy can do. And, you know, we were okay with that. We wanted to save our child, you know, in the moment and at that time. So when we started to go through the motions and, you know, started treatments weekly, he would have an overnight inpatient once a month, along with a 5-day stay. It was actually an outpatient chemotherapy per the protocol that he was on, and that chemotherapy in general was awful. It made him so sick. He also ended up with C. diff, which was really frustrating because you know, they give antibiotics for the C. diff, but then like that's kind of what can cause C. diff. It was just like literally a constant circle of like my child just not feeling well because of all the stuff that you keep putting inside of him to save his life. And when I look back with the first 3 months of treatment, I just am like, gosh, I wish I would have known what I know now, because I would have refused a lot more things, or I would have like spoke up on things, or would have asked to have had conversations about things, because a lot of things since Sage was 3, and like I said, I knew nothing. It was just kind of like, we're taking control, we're going to do what we need to do. And I'm not saying it was a terrible thing, it wasn't, but what I know now, I wish I knew then, right? So the first 3 months of his treatment, I woke up one day and I was just like, you know, I'm not just going to be the passenger anymore, and I'm going to see like what we need to do. You know, the shock wore off and it was time to fight. And I told my husband, Brad, you know, like, let's kind of look into this a little bit more. And that's when I joined the Facebook social media groups, specifically to rhabdomyosarcoma. And I did not do that in the beginning because I didn't want to see the numbers. I didn't want to see the deaths. I didn't want to see, you know, the triumphs. I didn't want to see all of that because we were in our own journey at that time. So when I decided to join them is when I was like, oh my gosh, like this is not, like, we were not sat down and, you know, told that this cancer really, really sucks. And there are some things that are very specific to rhabdo that could potentially, you know, save him. And I remember, you know, telling my husband, okay, I don't think Sage is on the right protocol. Like, I think we need to speak up. And he's like, you know, because we're both kind of like, I'm more confrontational than he is, but when it comes to my child, like, move out of the way, you know, it's like, he can't speak for himself. So after getting a lot of conversations throughout the rhabdo community, other patient survivors, advocates, etc., him and I decided to get a second opinion. So this was 3 months in. And when we received our second opinion, that oncologist said, you know, he's not on the wrong protocol, but there's a better protocol. And at that time, you know, it was like, it kind of was almost like a relief. I was like, okay, I'm, you know, because I'm doing all this research. Am I crazy? Am I not crazy? Is not like nothing was brought to my attention. And we went to his oncologist and we got his protocol changed, and he was wonderful. He was completely on board with it. And we changed his protocol for his treatment right before radiation. So he received radiation with his chemotherapy, just like Tasha. At week 12 of his protocol, he received photon to his right calf, along with all those nodes at the same time. So that was a 6-week part of our journey. We drove back and forth every day. It was easily the hardest part of our season that we were in. It was, Sage had to be sedated every single day. His port had to be accessed and stay accessed. I think we took it out on Fridays, and then he wasn't accessed on the weekend, which was so great. And then, you know, he'd get access again on Monday. And it was awful. It was such a hard time during our journey, was radiation. So there was really no clinical trials discussed with us. There was no other options or resources. Everything we had done or we did was on our own. We reached out to other, you know, all throughout the country, other places, other hospitals. I connected with another advocate who mentioned the information project with Beat Childhood Cancer. That was something that was never offered to us. Sage's tumor was, when it was biopsied, you know, it's usually foundation 1, or there's one that starts with an M. I think Christy can help me on that later, but there's another one too that usually they go through, and Sage's was foundation 1. And when I was going through all of, you know, the biopsy information and everything, there was no like RNA. It was just the DNA of the tumor, which was really kind of eye-opening, because there was a lot of people who got RNA, you know, within their biopsy. So that was something that was interesting. So we went ahead and did the information project through Beat Childhood Cancer, and that was very eye-opening as well. We got the RNA information, and she mentioned that there was something in that RNA that maybe we could have threw in during radiation that would have sensitized the tumor a little bit more. So that was kind of like, gosh darn it, you know, you're trying so hard and none of this was offered. And it's like, you're really, you're trying to save your child's life. And at the same time, like, you're trying to balance your mental health and you're at home and in your life and everything. And it's like, if all of these would have been offered to us in the beginning, it would have been a lot easier. Some of the challenges that we did face were exactly what Tasha said. There's no answers. It's not black and white. There is all these gray areas. And I would come to his oncologist and we would talk about the research, and I would talk about some things that Christy and I had talked about, and he would always have the patience and sit with me and, you know, talk about these things. And his answer every time was, Natalie, you want the same thing as I do. You want answers, and we don't have them. And I think that's the hardest part about having a rare cancer. And he's right, it is, because how do I go to sleep every night knowing that there's no cure, there's no answers, right? Like, we can only do what we can do. And I remember I did the vitamins, I did diet, I did, you know, everything that somebody would tell me to do, I do. And it really doesn't matter in the long run. You know, cancer doesn't care who you are. Some resources that were especially helpful to us was just a lot of internet searches, not Google. I wasn't a Google person. I did a lot of COG, PubMed, and then I have on my notes Christy. Christy was my number one resource. She was so incredible. And some of the resources I wish that I had were just specific rhabdo resources. When Sage was diagnosed, we got a binder, and it had a lot of general information in it. It had the COG handbook. When I went back through it, it had like, what is rhabdomyosarcoma? Like, it was just all very general. It didn't have the subtypes of rhabdomyosarcoma. It didn't have the different protocols that could be, it didn't have a lot of the stuff that I needed. And throughout our journey, we, at that 3-month mark, when we got our second opinion, it was with Dr. Pete Anderson at the Cleveland Clinic. And he has been our therapeutic alliance since then. And he has been absolutely incredible. And when we met with him the first time, he like writes up this really great summary of your child. Like it is personalized to your child. And I think as parents and advocates, as parents, that's what we want. We want you to see our child as, I want you to see Sage as Sage. I don't want you to see him as a number. I don't want you to see him as, a general rhabdomyosarcoma, diagnosis. That's not who he is. And his summary involved all the dates that things happened with Sage, what doctor he saw, because I don't remember. I can't go back through my chart. I can, but my chart needs a little updating with some filtering, because that would be very helpful. But he did this all for me. So resources like that were extremely helpful. And I just wanted to mention another resource that would have been helpful, because most sarcomas need radiation, would be more radiation resources. Throughout our journey, we didn't really expect that radiation, you can get like a second opinion. Like it feels weird to be like, I need a second opinion for radiation, right? Like, because you're all in one group and you just, okay, on to the next thing, like on to the emotions. And radiation towards the end of Sage's protocol, it called for a very specific radiation to his bone. And where we were treating, they didn't really want to do that. So I had to reach out, to different rad oncs to figure out, what am I supposed to be doing here? So I think it's important that it's not only second opinions just for, your oncologist, but for radiation oncologists as well, because a lot of times they don't work together, from what I understand, unless it's a very specific case. But that was really all I had for Sage's story, and I'm excited to hear Dan's story.
Thanks,
Your story
Dad.
was a lot harder too. My gosh, you guys have tough stories. I'm the easiest sarcoma guy ever because I live alone with 3 cats. But man, if my 3-year-old had rhabdo, woo. I'm gonna do this in 5, Christy, so that we have plenty of time for Q&A. All right, if that
We'll
works.
we'll have plenty of time. Do your thing.
Okay. The thing that I usually start with, and it's in my notes up there on the wall, is like Christy said, everybody's journey is totally unique. And whenever I mentor patients, and I generally do liposarcoma patients and I do terminal patients, I'm a great guy to do terminal patients as a mentor, because I have all the right links for resources in terms of, if you have metastatic liposarcoma in your lungs, you're absolutely going to die from this, most likely, unless you're a really bad driver. But at the same time, I also say the really cool thing about liposarcoma is, if you look at a Kaplan-Meier curve for folks that have myxoid liposarcoma, which is a great big group in LPS, or if you have well-differentiated, which is a great big group in LPS, you have like a 92 or 93% 10-year overall survival. So if you're new to this particular journey, there's a lot of really bad stories, but there's a ton of people who have sarcoma that are going to live to be 105 and sit on the front porch and play with their dogs and stuff. So that's what I usually start with. So my story. My only symptoms were I was totally exhausted, and I'm usually like a 3 or 4 hour a night sleep person and have been forever. So I was 53 at the time. I'm 58 now. I was totally exhausted for about a year. I had my weight, which is usually 220, going up and down and up and down and all over the place, which I figured was just being old, Um, and I had spermatic cord sarcoma. So my testicles, I flew about 150, 170,000 miles a year. My testicles hurt a lot. So technically, I'd gone to the doctor for a year beforehand saying, I know that you can't get testicular cancer after 30, like nobody does, right? It's just not an old guy cancer. And they said, no, you probably just got something weird going on because you're getting old. So there I am in Mississippi on that 3-week trip. And I had one of my area VPs working with me. And I said, dude, would you feel this? Because I think it's an indirect hernia. Do you think that's an indirect hernia? And he felt it. And by now it was about lemon sized or tangerine sized. Like it was a pretty good lump. And he goes, man, you're stupid. That doesn't feel like an indirect hernia at all. You can't move it around at all. It's not in the right spot. And we're supposed to go to Arkansas the next day. And he made me go home. So I had ignored it for a while. And I went straight to my general surgeon friends, and I next day walked in with him and I said, dude, do you think this is an indirect hernia? And he felt it. And he said, man, I haven't taught you anything, because that's definitely not an indirect hernia. That's a tumor. And then he walked me across the hallway to a genitourinary surgeon that we both knew. And he said, man, that's a tumor. So for me, in terms of differential diagnosis, I got lucky because I had friends, right? Now, at the time, they said, that's a really strange place. So it's probably sarcoma, because men don't get spermatic cord non-sarcoma cancer. The longest period for me, it took 6 weeks to get Blue Cross I shouldn't say names, to get my insurance company to approve the surgery, which was really strange. So finally, July 20th, 2018, went in. And as everybody knows that's had sarcoma surgery, you have really big margins. So I got about a 16-inch scar on my pelvis that goes from my hip bone all the way down and then around, right? So great, big, huge margins, really great surgeon. Love the guy. And I was an add-on on a Friday because they approved it on Thursday night. And he called me and he goes, let's get that out of you, because it had grown a lot in 6 weeks. So we pulled it out. He asked me if I wanted to stay in the hospital or go home. I said, I'm good. I'd had 11 surgeries before that are non-cancer related. So I'm pretty good taking care at home. And my cats are really smart. So I went straight home. And he also said at the time, like Tasha said, mine was totally necrotic. Like if you looked at that, I saw pictures of it. It was black, right? And I've been in surgery for a long time. So we knew it was highly malignant, just didn't know what type of malignancy it was at the time. So it took a total of 4 weeks for me. I'd like to give a shout out to all the sarcoma centers out there. I lived in La Jolla, California at the time. I did not go to the one sarcoma center in Southern California, which is UCSD. That was a big mistake. The hospital that I was at had done my previous 11 surgeries. I love them. They did great work on me all over my body. However, their path department had no idea what my thing was. So then they sent it to Indiana University because they knew a guy there. And the guy at Indiana University said, I think it's Ewing's, or it might be a Ewing's type. It's some sort of weird fusion thing that we don't really know what it is. So then they sent it to Sloan. And Dr. A there, who's just a ridiculously brilliant pathologist, within 4 days, came back, said, look, we did a fish on it. You got MDM2 and CDK4 overexpression. Absolutely, totally dedifferentiated liposarcoma. Had a mitotic count of 40, which is just ridiculously high, which is why it grew so fast. Had lymphovascular involvement and like 95% necrosis. And it had a really odd round cell look to it. So my doc said to me at the time, this is probably going to metastasize, right? The bad thing about sarcoma is, rare and ultra rare. The good thing is you can kind of tell from your path report and how deep it is and what it looked like, what it's going to do, right? Like I knew I was going to get Mets right away. I'd seen the picture of the tumor. I knew it was totally involved with my vasculature, and that's how LPS metastasizes. So then I had 8 weeks of radiation, and I'd like to right now hold up my one slide, which says, this is ASTRO. These are the guidelines that came out in 2021. If you have sarcoma, you look up ASTRO for the 2021 guidelines, and they will tell you, using peer-reviewed evidence, exactly how radiation works on your tumor. Within LPS, it really works great on myxoid and pleomorphic. On dedifferentiated liposarcoma, it's pretty much like pouring wine on it. So go ahead,
So we
Christine.
didn't even ask Dan to make this plug, but there is a SFA webinar that is available online that goes over the Astro guidelines. So please feel free to check that out for some more information.
And
Go ahead,
and so important, and I'll tell you why. I'm glad Tasha brought up the morbidity aspect of it, right? I will say that I was not at a sarcoma center. I'm going to be careful with my words. 9 out of 10 of the peer-reviewed journals out there says dedifferentiated liposarcoma, radiation's not going to do anything to it. And for the love of God, if you're going to do it before surgery. And really, for the love of God, don't do it in the pelvis. My entire pelvis looks like Deadpool. I have chronic radiation poisoning on both legs and the entire middle section that there was no reason for it. And you think about it, I mean, I've lived my life in peer-reviewed research, but you get smacked in the face with cancer and you kind of lose your sense of direction for a while. So I had read exactly 0 peer-reviewed journals on radiation therapy for DDLPS and didn't figure out until afterwards that I really should have, as my best advocate, said, I've read all the information on it, and it really doesn't do much for it. It's not going to do anything. We got good margins. So anyway, 8 weeks to that. And then I was in and out of the hospital 3 times from November 2nd until January 6th with really bad infections in my pelvis that we couldn't get rid of. Like I was almost septic because I had so many infections, because I had a surgical site infection. Plus I had really bad burns from the radiation. So then I thought I was healed, right? Good to go. Just waiting to see when the lung mets would come in. July rather of 2018, I had my first lower right lobe lesions, and they showed up where most of us sarcoma people will get it in the lower right lobe first because the venous part comes in right there. Had like 3 millimeter ones, and had moved my care by that time to a sarcoma center in a different state, and was friends with that guy. And he goes, "That's good. 3 millimeters, no problem." And then 2 months later, I was on an every 60-day pelvis, abdomen, and chest. And then I had a 7 millimeter one that popped up in 60 days in my middle right lobe. And he said, "Dude, that's the one that's going to kill you." And I said, "Okay, fair enough. I've had a great life. I'm going to plan." So I sold my house. I had a place in La Jolla looking over the ocean that was beautiful that I'd been in for 27 years. Lucky, single, no kids, just cats. And I'd always wanted to live in a Winnebago. So I moved into a Winnebago, and I'd always want to go to Best Friends Animal Sanctuary here in Kanab, Utah, because it's the biggest animal sanctuary in the galaxy. And I came here and I fell in love with Kanab, and I never looked back. And I've stayed here ever since, in a little town of 6,000, because I get to go to Best Friends all the time. And I think that's what's kept me alive, being really lucky. I've got a bunch of little lesions in all of my lobes, and I'm an outlier. They show up and then they grow to like 6 millimeters, and then they scar over. And I've got some other small things like near my pancreas. But I'm one of those weird people that you see in clinical peer-reviewed stuff where like it works on 2 people, but it was a sample size of 20, so you can't really extrapolate from it. So it could have been the medicine, might not have been the medicine. That's it. So I just go get scanned every 90 days. The first time that I got the lung mets, I interviewed hospice people. I've got an end-of-life doctor in California because I'm a Death with Dignity proponent. And I talked to a lot of folks about that when you get lung mets, it's a real good time to, get everyone around you, hug it out, and figure out your plan for however many months you got. Because it's not giving up. I'm a huge proponent of saying it's not giving up, to say with metastatic sarcoma, it's terminal, but you can have a great time while it's terminal. I've had an amazing, I was a workaholic before. I had no time for myself. So getting sarcoma for me was kind of cool. I do have a last slide. It says what everybody else said, right? Be your best advocate. What did you learn, right? Learn to read clinical studies and have your sarcoma team work with you on that. You can find every trial out there at clinicaltrials.gov. So you don't have to go to MD Anderson like everybody thinks. You can get in them even if you don't go there. And the last one, I'm glad Tasha brought it up. Before you have surgery, get a referral to physical therapy. I'm fully disabled now because of the radiation. It killed all my lymph beds, so I have PT. Find a therapist. Terminal cancer patients have 4 times the risk of suicide. So it's always good to talk to somebody. And then on the family planning thing, you also have family planning doctors at all your hospitals, and you get it paid for. So especially if you have pelvic cancer like I had, it's really good to talk to docs about that because it totally changes your dating and sex life and all that. So that's it.
Thank you, Dan. That was a lot of great information.
You're welcome.
And we have some really awesome questions that came in. So I'm going to triage them just a little bit because of time. But I'll start with a question. What is the first thing that you would tell a recently diagnosed patient to do? This isn't for anybody in particular. So if anyone wants to take that one.
Tasha, you're the SFA person now.
Yeah, I was going to say.
Yeah, man.
Represent. The first thing I would do, and I want to say I'm very lucky that it took 6 opinions to get here, but I landed in the care of a team that I felt very confident in once I was diagnosed. I will say that the first thing I thought was, okay, well, I just got a rare cancer diagnosis. You're supposed to get a second opinion. So that was my first thought. And then I thought I just had 6 opinions. So what the heck do I do now? And felt extremely lost. With that said, I immediately connected with my oncologist as a human, and as he's a brilliant person, quite frankly, one of my favorite people in the world. Not just because he saved my life, but he's brilliant and really nice. But I would say the first thing is make sure you like your team and agree. You're going to be overwhelmed when you first get diagnosed. So I would be careful with saying like you agree with the plan, because you're probably like, what the heck is this plan? And you're just getting information. But I would say make sure make sure you like your team, because you can fire your team. Like you hire them. You're in charge, like my oncologist said. And so if you don't like what you're hearing, yes, go get another opinion, go seek out other teams. Because I just thought second opinions are like something you do in the medical world, I asked my oncologist, I was like, I like you and I like your plan, but I think this is what I'm supposed to do. And he said, I would be shocked if you didn't get a second opinion. And we had an open discussion about what he was doing on his end. And because I was a case being reviewed by Tumor Board, which is where a bunch of oncologists come together and talk about the case. I know that Dana-Farber hospital in Chicago, and oncologists in Chicago, I know that there were multiple, I think one in Vancouver. I know there were multiple sarcoma oncologists who were talking about my case. And so we had a discussion where I felt very confident that he was getting more opinions than I could actually find in that moment. But I did get a somewhat unofficial opinion from Dana-Farber. So I would say if you're not 100%, be 100% sure about your team and go get another opinion if you do feel that you should. Foundations like SFA can help you with these things and help find you resources. So you're already doing a first step by attending this, but I don't think you need to go crazy if you like your team, but kind of like Natalie touched on, if that changes throughout the course of treatment, you can change your team. I have friends who have done that with other types of cancer. I know of a rhabdo mom who was being treated in Florida and is now at Boston Children's because they didn't agree with their protocol in Florida. So, you can change that throughout. I would also say don't drive yourself crazy with the Googling and the researching, because of course you also think, okay, I should do my research, and you should learn about your treatment. I think in order to make informed decisions about your care, you should inform yourself about what's happening, but also protect your mental health. Don't drive yourself crazy. There are specific resources like some that SFA offers, where the information is there. It's not, you know, scary statistics on Google, scary stories. I was very careful with the information I was taking in. Very similar to Natalie, I didn't want to see death. I didn't want to see outcomes that weren't desirable, even though that is a reality. It wasn't blind optimism. That's a reality I knew of, and I knew to protect my mental health going into what would be an extremely tough period of my life. I needed to put information in front of me that was going to help me and inform me and help me make the best decisions for myself. So I would say, you know, don't drive yourself crazy with like, I need to get all the opinions, I need to get all the research. Find the right opinions and the right research. And if you don't know what that is, because you probably don't know what that is when you're getting diagnosed, go to the experts, go to the foundations and the people who have experienced it, who can put you in the right direction, to help take that guesswork out for you and point you in the right path.
Thanks, Tasha. This question is for Dan. What recommendations do you have about approaching your doctors with research that you have found, and how do you start that conversation with them?
Oh, sure. Yeah. I would Columbo it, right? I like to go in with printed out peer-reviewed stuff, right? Because the first, bless Tasha for saying that. I should have fired my RT. He was the head of the department. He chose me because he thought he could publish me. I found this all out later. I went in with peer-reviewed research, and he said, "Oh, have you looked at the Google?" And I went, "Dude, I got 2 master's degrees in live-in surgery, so don't play that with me." Then now I go in and I said, "Could you help me understand this?" And I would generally have circled things, right? Even if I know the stuff, and say, "Could you please walk me through this?" And quite frankly, my dude at the second place, and my person now up at Huntsman, great people. Like they'll go, "Have you read anything interesting lately?" Because if you think about it, like if you're even a sarcoma specialist, like Christy is a fusion specific sarcoma person, right? Like she's right here doing a research and everything. We have one flavor of sarcoma, so we can read like 100 peer-reviewed things and might bring in something new. So, yeah, but I'd bring it in, circled and highlighted, and say, "Can you help me understand this?"
That's great. I think also that's good advice for how to make the conversation disarming, so that it's, you know, a good way to facilitate that conversation. That's really helpful. And then this question is for Natalie. How did you find out about clinical trials, and where did you find that information? And when you reached out to other places, how did you go about reaching out to other places?
Sure. As far as figuring out clinical trials, it actually came down to that group that I joined through social media, with, just like both of them said, the caregivers, the patients, the people who have been through it, the ones that have already done all the research, kind of laid it out for me. So I pulled what I could and presented it to his oncologist. I did go through COG, you know, just to make sure. NCI has them on there as well, just to kind of make sure that I had the right information. And there was a high-risk protocol out at that time. I do believe it was closed when Sage was diagnosed, but it doesn't matter. You can still get into a clinical trial. If that clinical trial is closed, please still bring it up to your oncologist. Just, you may not be able to be in the part where they're part of the actual trial, but they can still get those drugs. They can still be on that trial. So please bring it up if you feel that you need to do something like that.
That's great advice. Thanks, Natalie. Okay, so at this time, we will have to conclude our session, and we'll have to wrap up for this evening. So, excuse me here. Let's see. Thanks to everyone who tuned in today to be a part of this discussion. As a reminder, today's session was recorded, and a link will be posted to SFA's website within the next few days. Thank you to Tasha, Natalie, and Dan for taking the time to be with us today and for sharing your stories and experiences. We, of course, appreciate not only your willingness to share your stories, but also how each of you are continuing to give of yourselves within the sarcoma community. A reminder, you can find SFA online at curesarcoma.org, where you can also find information about archived and upcoming education sessions, including the Astro session that Dan mentioned earlier. And this will now conclude our discussion for this evening. Thank you all.
Thank you.
Thank you so much.